thanks ever so much, everybody, for joining us this morning. It's wonderful to have you here with us. My name's Cathy Creswell. I'm the lead of the UKRI Emerging Minds Network. And thanks to everyone who's already introduced themselves in the chat. If you haven't done that yet, please do. And it's also lovely to see people making connections there for hooking up and finding out more about what each other are doing. So please do continue to do that. Many of you will already know, but for those who don't, the Emerging Minds Network is a mental health research network funded by UK Research and Innovation, one of the UK research councils, with the purpose of supporting and encouraging more research across sectors and across disciplines that will help to make a difference to children and young people's mental health. So when we started the network back in January 2019, we worked with our partners Young Minds and the Centre for Mental Health, who ran workshops with young people, parents and carers, practitioners and policymakers to identify the key priorities for research. And that helped us set our 4 main research challenges. We've held a number of calls before, focused on some of the other research challenges, but the one that we're focusing on now and that we're talking about here today is the one that was called the big question, which is really why, when we know what works, is this not necessarily put into practice? So that's what we'll be focusing on today. And today, in the first half of our session, we'll be hearing from a number of colleagues on the findings from reviews that they've recently conducted, where they've looked at relevant literature. And after that, we'll provide an overview of the priorities that have been identified by policymakers and commissioners of services, as well as those identified by parents, carers, and those young people that these services are targeted to support. So I hope that whether or not you're interested in our specific funding call, you'll learn a lot and get a lot of useful information from these various talks as well. But towards the end of the session, we'll also share further information about the funding call, which aims to begin to address some of these priorities and the gaps that are identified. So please do use the chat box throughout. Really great to hear your reflections on what you hear, but also we will be stopping at various points throughout the session for a chance to address any questions that have been raised. So please do put the questions in the chat and we'll keep an eye on those and try to pull them out as we go along. So without further ado, we're going to move on to hearing about some of the reviews, and we'll be hearing from 3 speakers who will be describing existing research and evidence on this topic about implementation of evidence-based practice in child and adolescent mental health settings. So each will share the latest evidence and findings on barriers and facilitators to the implementation of evidence across community, clinical and digital healthcare settings. So as mentioned, please do share any comments or questions in the chat box. And first of all, we'll be hearing from Abi Thomson, who is currently working with us as an Emerging Minds intern, working on the Big Question Research Challenge. And she's been carrying out a rapid scoping review in this area, more specifically looking at barriers and facilitators of community-based implementation of research for children and young people's mental health promotion, prevention and treatment. So Abi, I'll hand over to you now. Thanks very much.
Thank you, Cathy. Great. So I'm going to share my slides. So hopefully everyone can see that. Fab. So yeah, thank you all for coming along today. As Cathy mentioned, I'm the intern and I've had the pleasure of working with Emerging Minds for the past few months on this research challenge. And so as part of that work, I've been carrying out a rapid scoping review, exploring some of the barriers and facilitators of implementation of evidence-based interventions within specifically community-based settings. So just a bit of a background towards the rationale for why we've been carrying out this review. So as I mentioned, the key rationale was to sort of be part of the preparation for this funding call. So we wanted to provide an overview of the existing evidence in the hopes of informing some of the priorities for this Big Question Research Challenge. So the Big Question Research Challenge is one of 4 key research challenges which were prioritised by young people, families, practitioners and policymakers, which aimed to reduce the prevalence of mental health problems experienced by children and young people. So the promotion, prevention and treatment of mental health in children and young people is clearly a growing priority within the public agenda. So these images, which you can see on the slide here, are all headlines which were taken from articles just within the past week. So it's clearly a real area which everyone's aware of, and the prevalence rates of mental health conditions are clearly rising within the UK. And especially with the added challenges of the last 18 months, the focus on research and services to support children and young people has never been stronger. So for researchers who are seeking to implement evidence-based interventions to support these children and young people, are obviously aware of this landscape, but perhaps we need to do more to understand what this might mean for putting research into practice. Evidence-based interventions do exist for use in community-based and school settings. So for example, voluntary and community groups supporting children, charities, third sector organisations, and also schools, which play a critical role in the community for families and young people. So given this critical role, we felt it was important to explore the challenges that these organisations and providers face in using evidence-based interventions, so we can understand how we can best support children and young people during this difficult period. So the aims of our review were to identify the barriers and facilitators of implementation within community-based services and schools, specifically for children and young people's mental health prevention, promotion and treatment. Ultimately, though, we wanted to take this further and provide practical guidance and suggestions for those implementers within these settings, be it teachers, volunteers, parents, or even young people themselves. So we began by creating our search strategy. So we worked with a librarian from Bodleian Library called Ellie Harris, who was amazing at helping us to refine our search strategy, run the search and gather all of our literature. So we searched 8 databases, specifically looking at literature from within the past 10 years. We included only primary research studies from peer-reviewed journals, and we also only included data which was collected within the UK. In the case of this review, we felt that focusing our search specifically on the UK would provide a better overview of the specific challenges and the landscape, in the hope that we could sort of have a better understanding of the specific barriers and facilitators across different regions within the UK. So this slide just shows the records that we identified and that we've screened so far. So it is worth mentioning at this point that we are still in the process of finalising this rapid scoping review. So we have screened at title and abstract, and this has been double screened as well. And I have also screened at full text, but we're still waiting for this to be screened by a second coder. But as you can see from the flow diagram, we only identified 5 studies which met our inclusion criteria in the case of this review, and demonstrated barriers and facilitators to implementation. And all of these studies were school-based, so we didn't identify a single study actually which looked at barriers and facilitators within community-based organisations. So as I mentioned, we're still working on finalising our review, but we thought it'd be important to share some emerging findings which might be useful in helping you prepare for this funding call. So I'll begin by just giving an overview of some of the barriers which have been emerging within school-based implementation. So obviously a really key barrier, which I'm sure we're all aware of, is competing national priorities and targets. So schools are built to support the academic development of children and young people, but as demand grows for services to support well-being, waiting lists get longer. Schools are becoming a place where the well-being of children and young people is also now a priority. However, in comparison to the academic development of children, this potentially provides a barrier as the resources aren't perhaps there to support schools in implementing evidence for well-being. Some organisational barriers as well include a lack of time and resources, relative priorities within schools. So certain schools might prioritise wellbeing more than others, and that provides a barrier in terms of implementing evidence-based interventions at scale. Also, the complexity of schools and the specificity of the way in which they work. And also the school culture and beliefs provided a barrier to implementation, again, around, what the school felt that its role was and how they believed that they could support their children and young people. At a more individual level, some emerging barriers were the accessibility of research to parents. So many interventions found that the logistical way in which they engaged parents presented a barrier. So, for example, gaining consent for participation in interventions was unsuccessful because of the way in which they communicated and engaged parents within the school community, which hence meant that the intervention did not go on to be implemented. Other individual barriers included the level of support which teachers were asked to provide for specific interventions. So as we know, teachers have very limited time, work very long hours, and if an intervention was built in such a way that a teacher had to provide a lot of time and a lot of energy in supporting and supervising children and young people, it was also less likely to be implemented. And the final point was just around student age. So there was a lot of comments that interventions were a lot easier to implement within a primary school setting than a secondary school setting. So some facilitators to mention as well. So at a systemic level, high quality training was a facilitator which came up across the studies which we included and was notable in terms of providing those implementers on the ground with the confidence and also the willingness to implement within their own settings. Also investment in programs, which I'm sure everyone is aware of. So investment coming from those people who are setting the targets, setting the priorities, that are often competing with each other, can really facilitate the implementation of evidence. At an organisational level, a key facilitator for implementation was found to be strong networks of communication within a school, and also having accessible points of contact with those working on the intervention itself. So having someone that teachers or parents or young people could speak to really easily if they had any questions about the intervention. Also, interventions that complemented existing resources within the school and used tools which were familiar to staff and students were a lot easier to implement than those which required a sort of upheaval in resourcing and time. And finally, some individual facilitators which were emerging within the literature were around having implementation advocates actually within the school setting. So oftentimes the people who were advocating for an intervention were not the same people who were implementing it. So it meant that those implementers, while they could support its implementation, perhaps didn't promote it in the same way that someone who had helped build it and shape it and advocate for it would. Also, effective leadership was found to be a key facilitator. And there was also a commentary around teacher-directed versus student-requested interventions. So those interventions which allowed the student to take some responsibility for its delivery, get involved in the implementation, were found to be a lot easier to implement than those that were perhaps led by teachers specifically and directed by them alone. So finally, just some key takeaway messages from our review. So as I said, we are still working on finalising our findings. But what we've already seen is that there's a clear lack of evidence on the barriers and facilitators overall within these settings. Now, there may be a limitation with the studies that we chose to include, but we didn't actually find any from within the community and voluntary sector. So there's a clear gap there and a disconnect between the evidence base and the people who are actually working within those services. We also found that there was a lack of pragmatic strategies and tools for implementation, and that across the studies that we included, there wasn't actually a cohesive framework established for supporting the implementation of evidence-based practice, which was a clear barrier. So despite the key role which schools, community organisations, voluntary support services and charities play in improving the prevention and treatment of children and young people's mental ill health, there really wasn't any guidance around how to use evidence or how to use research and adapt it to your own needs within a service. So yeah, thank you all for listening. I hope that provided a bit of an overview of what we found within our review. But if you've got any questions, then please do pop them in the chat. I'll hand over to you, Kathy. Thank you.
Great. Thanks very much, Abby. That was fantastic. We have just got 2 minutes spare in our agenda, so I'll take the opportunity to just ask you one question now, and that's from Tim Clark, who said that this was great. Abby, thank you. And did you notice there were key differences based on the type and duration of evidence being implemented?
Yeah, no, that's a good question. So again, we are still working on the review. I will say that a lot of the reviews which were perhaps less successful were those which involve technology within schools. So a lot of the research which we included came from schools which, so not special schools, but mainstream schools from sort of the same demographic, you know, middle class, working class background. And one of the differences between, I guess, the barriers and facilitators was that in those interventions which perhaps called on technology to be used, there was a comment around the increased amount of supervision that required, and the difficulties that teachers found in actually implementing that with students who were perhaps more at risk, and that they felt less confident in using interventions of that nature within a school setting, because it required, you know, teaching of the technology and the tools and that sort of stuff. So yeah, I will say that those interventions that required or relied on technology in their implementation were perhaps a bit more challenging within schools.
Great, thanks very much. And if you have any other questions, please do, as Abby said, keep popping them in the chat, because we will have more opportunity later on as well. But I'm now going to introduce you to Araminta Peters-Corbett, who I'm delighted has been able to join us today. Ari is an assistant psychologist from Norfolk and Suffolk NHS Foundation Trust, and she works with the Bridge Special Interest Research Group, which is one of the Emerging Minds supported special interest research groups. And if you haven't discovered them yet, please do have a look at the Emerging Minds website, where you can find information about all of the special interest research groups that we support, including Bridge. Bridge focuses on implementation of research and evidence-based practice in children and young people's mental health, so it's likely to be of huge interest to everyone who's joined today. But as part of their output for the Bridge SERG, Ari's been carrying out a rapid scoping review exploring the barriers and facilitators of implementing evidence-based practice and research, this time focusing on children and young people's clinical mental health settings. So thanks very much, Ari. Delighted to hand over to you.
Thank you. Let me just share my screen. Okay, can everybody see that?
No, not yet.
No, not, oh gosh. Okay, sorry. It worked earlier. Oh, why is it doing that? Sorry. Share screen. Okay, how about now? Is that all right?
Perfect.
Okay, good, thank you. Yes, hi everyone. Kathy, thank you for introducing me. I'm Ari and I work as an assistant psychologist for the Norfolk and Suffolk Foundation Trust, and as part of the Bridge Network, which is one of the Emerging Minds supported special interest research groups. And as Kathy said, we focus on advancing and growing evidence-based practice in children and young people's mental health. So yes, as part of our output, we have been working on it started out as a rapid scoping review and very quickly became a bit bigger than that. So we've classed it as a systematic review on the barriers and facilitators of implementation of evidence-based interventions in children and young people's healthcare. As Abi was saying in her review, they focused on more community and school-based settings, and we focused on the clinical settings. So in terms of the rationale, as Kathy said, this very much came out of the Bridge Network as one of our outputs. Our special interest research group is comprised of clinicians, academics, clinical academics, young people's advisors, parents and care advisors, commissioners, all different kinds of people and stakeholders involved in this. And when we were setting our priorities at the beginning, we heard from pretty much all of our members that we know that there is a lot of research that is done, very good research, and that it isn't going anywhere. There was also a lot of talk about what the barriers and facilitators in those things are. They do seem to be well documented, but there is a lot of reinventing of the wheel. And as Abi made the point in her review as well, there's a real sort of like lack of strategies and tools in order to overcome those things. So our aim here was really to put everything in one place definitively, and then use a framework to come up with some real solid pragmatic strategies for facilitation. So yes, that was our rationale. In terms of the process, we also had a librarian to help us define our search terms, who works for Norfolk and Suffolk Foundation Trust as well, who's really, really good. And after title and abstract screening by 2 separate reviewers, we included 26 studies. We also reran the searches as of this month, and they are all up to date. We included all study designs in the end, including text and opinion pieces, just due to the diversity of the literature, in order to capture as much information as we could around this. We did assess everything for quality because there was so much diversity, and everything was found to be either of high or moderate quality. We also used the Paris framework in the review to kind of map our barriers and facilitators and focus on the solutions within the literature, because it felt like that was very lacking, and that was something that we wanted to make sure that we really, really focused on. So Paris focuses on enablers and barriers at an organisational rather than an individual kind of like change level, and has a really practical approach. So that fit really well with what we wanted to do. So we have a first draft of our review at this point, which is great. So I have some findings to share with you. So in terms of the barriers, they kind of very neatly split themselves into organisational level barriers and clinician level barriers. So I'll talk about them, or clinician or individual level barriers. So I'll speak about them in that order. One thing to point out is there were a lot of commonalities within the literature, which are within our findings that are very consistent with the literature. So in terms of organisational level barriers, some of the biggest ones and least changeable ones are lack of resources and under resources. That is things like time and funding, clinicians' time, and lack of funding, high service demand, readiness for change and innovation of the organisations, lack of supervision, lack of senior engagement, levels of knowledge around evidence-based practice, lack of measurability strategy, lack of leadership, guidance, clarity, and evidence of positive benefits as well was a very interesting one. If the organisation didn't feel that there was enough evidence of the positive benefits of implementing the evidence-based practice, that was also a significant barrier. In terms of clinician individual level barriers, clinician and individuals' perceptions around evidence-based practice were found to be a really, really significant barrier, as well as mirroring the organisational level barriers as well, and the kind of culture around that sort of resistance to change and innovation. Also, lack of training was something that came up a lot, and lack of consistent training, so skill being lost. Some of the papers found that they had some clinicians who were very, very good at implementing and keeping up with evidence-based practices, but if they potentially left their roles or moved roles, there was a lack of skill that wasn't replaced and it wasn't passed on. Competing priorities also mirrors that service demand for the organisational barrier. Also lack of information or lack of access to information as well. It was clear from some of the papers that there was a lot of information available on these evidence-based practices and implementing them, but it wasn't always readily available to clinicians to use. Also, the disparity between research and practice as well. So that kind of lack of joined up thinking between a research trial and actually what the clinical practice reality day to day was as well. Inadequate knowledge around evidence-based practice as well, lack of accountability and responsibility, lack of infrastructure and support. As I said before, lack of continuous training and staff turnover, which resulted in loss of skill. So in terms of facilitators, they're largely found to be the reverse of the barriers, which is helpful in one way because it means that those should be not easy, but clear to turn it into, you know, good strategies and tools and facilitators that we can actually use to advance this topic. So in terms of the organisational facilitators, things like resources, relative priority for workloads, having a shared priority of change and innovation as well within the culture, accessible and available funding. As with the barriers, accessible and available funding was marked as one of the least changeable barriers, so it's unsurprising that it's one of the most significant facilitators. Leadership, investment and supervision, specifically for the innovation and or change, not just a strong sort of leadership and engagement in the organisation in general, but specifically for the innovation or change that's happening. So that would be the evidence-based practice. And flexibility and regulatory mandate were also found to be facilitators as well. In terms of clinician level facilitators, similarly, they kind of are the reverse of the barriers here. So openness of the clinicians to change and innovation, continuous training and skills, positive mentality as well, knowledge of evidence-based practice. So whether that's training for the clinicians or previous knowledge of evidence-based practice is also really important, and their use. Also positive experiences of others using the change or innovation. So other agencies, other clinical settings, other organizations using something positively was a really helpful facilitator as well as ongoing training and education. So not only, because what was found is that a lot of clinicians will have a training session on whatever that innovation or evidence-based practice might be, but it's not followed up, resulting in loss of skill. So in terms of the implication of this, there's a real lack of cohesion and not one specific model or theory that really stuck out in the literature that everyone was using, which I think, Abi, sounds like is reflective of also what you've found so far in your initial findings. Factors relating to facilitation appear quite lacking in the literature. A lot of the things that we picked out were very barrier heavy, and most of the facilitators that we picked up were those reverse ones of the barriers, rather than kind of facilitators used to then create strategy or facilitation within those clinical settings. And that's something that the Paris framework, which we use to support our review, marks as a really key component to successful implementation. So we've made a point to suggest pragmatic changes to the barriers in order to create facilitation. So that's things like, for example, evidence and knowledge around evidence-based practices as well. We've also found that a lot of that isn't sort of like built into clinicians training and things like that before perhaps they get into like clinical work. So that's one of our pragmatic suggestions as well, that knowledge around EPBs and evidence-based practice, why it's important, can't just start with clinical work, but it needs to start with training much earlier on as well. There's also a real lack of joined up thinking between research and practice and organisations and clinicians. And that kind of goes for all of the stakeholders within this kind of topic. So in terms of people who are commissioning research, people who are conducting research, down to the people who are implementing the research in a clinical setting, and the people who are receiving it. There's what was very obvious from all of the research that we read is that these things are not linking up, and they're kind of operating as very discrete, unjoined up kind of components of this work, and that is seems to be perpetuating basically research not being translated and implemented successfully in practice. So that's a bit of a whistle-stop tour of our main findings. So thank you.
That's wonderful. Thank you very much indeed, Ari. There are various questions for you, but I'm going to go on now to Holly, and then we'll come back and have time for the questions after that. And notably, some of the questions are definitely aimed at both of you so far, and I think will be aimed at Holly too. So I'm delighted now to welcome Holly Bear, who's a postdoctoral researcher in the Department of Psychiatry at the University of Oxford, and her current research focuses on how implementation science can be used to enhance the adoption and sustainability of evidence-based digital interventions in adolescent and youth mental health. And as part of this work, Holly's leading a systematic review which aims to ascertain how evidence-based mental health apps for young people are sustained and implemented in real-world settings. So, of course, very relevant to our call. And so it's wonderful to have you. And over to you, Holly.
Hi, everyone. Thanks so much for the introduction, Kathy. It's great to be here to present on another aspect of implementation research, this time the digital focus, as you said. I guess I'll start off by adding that as part of my postdoctoral research, I'm working closely with Mina Fazel on the implementation aspect of the EcoWeb trial, which is an RCT, a randomized control trial, evaluating the effectiveness of a mobile app for young people being led by Ed Watkins at the University of Exeter. So in that project, I'm leading the qualitative work with colleagues where we're really trying to understand young people's experiences of using the app and using those experiences to ensure that the app is acceptable and appropriate and engaging and usable to young people, which hopefully will mean that it's more sustainable in the future and beyond the trial. So we're using it to kind of help inform how we can achieve successful implementation and longevity in the app. Now, to inform that research, we're working on several systematic reviews to kind of help guide our thinking, I guess. I think when we started this work, we thought it was important to look at all the different apps that have already been developed and tested and evaluated, look and see what happened to them, where they implemented, have they been adopted in practice, and hopefully we can learn from their successes and failures to enhance the success of our app. So that's a bit of background to kind of where our reviews have come from. So just a little bit of context then. So we already know that apps are showing a lot of promise in increasing access to timely and potentially effective interventions, while also reducing costs and addressing various health disparities that we know exist by providing access to typically underrepresented or underserved groups. And I think particularly against the backdrop of COVID and the various lockdowns and potentially reduced access to services and this kind of increased need for support that we're seeing, exploring digital approaches is particularly timely and relevant at the moment. But the other thing that we're seeing is that despite this potential, research often fails to translate into meaningful and sustained implementation in practice. So kind of echoing what both Abi and Ari have already said. So, you know, there's lots of evidence-based apps that have been developed and tested, but many are not actually available to young people who may benefit from them. I guess the other side of that coin is that there are many apps that are available online that aren't necessarily evidence-based and that haven't necessarily been tested. So there's kind of two sides to it. But I think given the potential of apps and digital interventions, it's important that where they are evidence-based and have been evaluated as having potentially beneficial effects for users, we can use implementation science to hopefully increase their availability to young people. What I did notice when we started to look at this area was that implementation outcomes from trials are often not reported, and implementation efforts often lack a theoretical or model-based approach, making it quite difficult to understand why implementation succeeds and fails. So across our programme of work, so both the qualitative work we're doing as part of the EcoWeb trial and then the different reviews we're working on, we're using implementation science frameworks to guide our research questions and our methods. So it's all model driven, which I think is important because it means we're being systematic in our approach to trying to understand why implementation works or not. Okay, so that being said, we started a systematic review to address some of those things I just mentioned. So this paper hasn't been published yet, we're still working on the results, but if you're interested, there's a detailed protocol online. And the aim of the review is to really determine how evidence-based apps, or if evidence-based apps have been adopted and scaled up in real world settings. So mental health apps that improve well-being or promote well-being or treat mental health problems. And we wanted to know what proportion of those evidence-based apps are sustained post-development. And the second question that was important to us was, what are the components needed for successful implementation and what are the common barriers? So our second research question is being guided, as I mentioned, by an implementation framework. So we're using Enola Proctor's framework in the States. She's from the States to guide our review. I won't go into a great deal of depth here about the methods because it's all online, as I said, but we looked at papers published during the last 10 years that reported on mental health apps for young people aged 15 to 24. And importantly for this review, we were really interested in those apps that had been shown to be effective in some way. So were evidence-based and had beneficial outcomes for young people. Much like Abi, we also worked with Ellie Harris who helped us with our search, and she was really, really helpful, so we couldn't have done it without her. Now you can see here that we trawled through a considerable number of papers, but in the end our search identified 36 studies published between 2011 and 2021. You can see here different reasons that we excluded papers. So they didn't have a control group, or they didn't have a mental health outcome, or they were out with age range, for example. Now, those 36 studies corresponded to 31 unique app-based interventions that reported beneficial intervention effects when compared to a control group. Now, the reason that the number of interventions is less than the number of papers is because some papers reported on the same intervention. And we identified an additional 87 studies where the intervention had not been compared to a control group, or where when it was compared to a control group, it didn't show beneficial effects. So we're actually writing a second paper to explore those interventions, the kind of, I guess, less evidence-based interventions, to get a picture of what's happened to them, what are their implementation outcomes. But at the moment, we're focusing on those 36 studies that were evidence-based. What you can see here is a publication year of the 36 papers. So it's worth noting that we did this search at the start of 2021, around February, March time. So this won't reflect all papers published in 2021. And of course, apps are being published all the time. But overall, it's clear that there's been a proliferation in apps over the past kind of 3 years or so. Here you can see the countries in which the research was carried out. So no surprises here really in terms of the disproportionate number of studies published in the States, followed by the UK and Australia, and then a scattering of other countries, so not really surprising. This figure gives an indication of the study design of the included studies, so mostly RCTs, as we would expect, with a few pilot and feasibility studies and some quasi-experimental studies too. Here you can see the population of the included studies, so a high proportion were university students. With this figure, it's worth noting that these aren't mutually exclusive groups, so some studies sampled multiple different populations, so these don't add up to the 36 included studies. And then finally, here you can see that most apps aimed to promote well-being or treat symptoms. Very few were aimed at prevention, and none were aimed at recovery support, which is kind of in line with what we might expect and we see in the literature generally. Okay, so as I mentioned, it's not always easy to find information on the implementation of interventions, as both other presenters have also mentioned too. So I contacted the authors of 30 papers to request additional information about the implementation of the app reported in their study. And I gathered that information using a kind of brief 5-minute survey. I didn't contact the author of 6 papers because they were testing an existing app that was already commercially available and discoverable to the public at the point of the review, so things like Headspace. And of the 30 that I contacted, 24 got back to me, so 80%. And of those 24, 15 apps, so about 60, just over 60%, I think that is, were made available after the end of the study. And then of those, 11 are currently available. So you can see at the top part of this figure here. And then 1 is now available that wasn't available previously. So we've got 12 currently that are available and 12 that aren't, so 50-50. And those are apps that showed some kind of beneficial outcomes compared to control. Here we can see where they were made available. So mostly on the App Store. These are mutually exclusive groups. So mostly the App Store, but some were made available non-commercially. So in mental health services perhaps, or in schools and universities. And I guess the next inherent question of this review, well, going back a step actually. So that's the data we've collected from the authors. We've also done some digging ourselves. So we're looking on the App Store, looking to see what we can find, etc. So we're collecting kind of data on successful implementation in several ways, but one of those ways was contacting the authors. So the next inherent question, I guess, then is after where they implemented, is what separates those that have experienced successful implementation and longevity to those that have not. So are there certain markers of success that we can pinpoint? And that's the question that we're working on at the moment. And it's a more complex question, I think. So the types of things we're exploring are the usability, acceptability, appropriateness, and engagement of the app. So, usability, is it easy to use? Is it actually usable? Acceptability, more about satisfaction of the app, functionality, attitudes and preferences. Appropriateness is more about the perceived fit. So it may be that a young person thinks the app is great and they like everything about it, but they just don't think it's for them. Maybe they think it's better for other young people or whatever. And these constructs are taken from Proctor's implementation framework that I mentioned at the start. So I've put the reference here if you're interested. And these are all things that we know are really important and are the building blocks for successful implementation and sustainability. So in order for an app to be engaging and well used, it must satisfy the conditions presented here, and that it must be usable, acceptable, feasible, and appropriate. So in the review, we're looking to see, one, if these things were measured. I think a lot of the time they're not, and if they're reported, and then what the paper actually says about these things. So did the 12 apps that are currently available have better usability and acceptability compared to those that are not available, for example? So as I said, we're still working on that. So to be continued on that front, but we hope to have the paper submitted the next week or two. So I will just end by saying thanks to my co-authors and to the survey respondents who answered our questions, and to the funder and the EcoWeb team for their support. So thank you for listening. I'll pass back over to Kathy.
Wonderful. Thanks very much indeed, Holly, and thanks very much to all of our speakers. It's been so fantastic that they've been doing these reviews right at the right time to inform this session. So we were very lucky to be able to get them all in. There's a few questions that we'll just go to now. So first of all, this was a question both for Ari and Abi. And that was about where most of the literature evidence originates from. So we obviously saw in Holly's review that most of it was North America. How about the ones that you identified? I mean, I appreciate, Abi, there weren't all that many in your review particularly.
You want to go, Ari?
Yeah, sorry. Yeah, I found the same. Lots in North America and Canada as well, like relatively few in the UK, and that's one of the reasons that we didn't define ours only to the UK, because we felt that we weren't going to have that much to play with otherwise.
Yeah, I mean, Same here as well. I excluded, obviously, because we only focus within the UK, but in screening found lots from North America, Canada as well, and Australia, where most were from, yeah.
Thank you. And Abi, a question from Matt Buttery about the interventions themselves that were in the 5 studies and how you distinguish between voluntary community sector delivery and other services. And he's highlighted that he's aware there may be a lot of overlap. For example, commission services, the voluntary community sector might be commission deliver services. For example, would it also be worth extending, and also he asked whether it would be worth extending the search to Ireland, as there are some good examples there. So I guess, yeah, interested to hear a bit more about the how you defined the community setting, and also I guess were there hints that there was much you were missing from Ireland in your review?
Yeah, that was another thing as well. I mean, there were a few that I excluded which were from Ireland too, so I know that there's a lot of great work going on there that's probably worth looking at. In terms of the actual interventions which were included, as I said, there was one which was technology based, and that was around anxiety prevention in at-risk students. So that was within a school. As well as that, there was also a whole school mindfulness intervention, whole school restorative approaches, and there was also an intervention around brief behavioural activation for depression in children and young people. So those were sort of the interventions which I looked at. In terms of the defining the community-based aspect of things, that was definitely a challenge. Right at the start of my internship, when I was trying to navigate this area, I actually spoke to somebody from the Anna Freud Centre about all this, and we sort of unpicked the landscape, I guess, within the UK and how these interventions are delivered, and that contributed a lot to me actually trying to define that within my review. We're gonna, I think, probably unpick it in the write-up quite a lot because it's something which needs to be touched upon, but I will say that when we were doing the screening, it was very much based on the implementers and deliverers and where they were largely rooted from rather than the commissioning.
Thanks, Abi. And another question for you, Ari, from Kishan Sharma, who just asked what organisations refers to within your review. He comments that one of the features of children's mental health is that services provided by various organisations, I guess this relates to the previous comment, both NHS and non-NHS, with different backgrounds, ethos, etc., which I think, as you highlighted, make it difficult to implement EBP. So could you maybe just say a little bit about how you defined organisations?
Yes, so perhaps I should have caveated the word organisations when I'm referring to organisational. It's the organisational provider that is provides that mental health care setting, so a clinical healthcare setting for children and young people. And you're absolutely right, they do have different backgrounds and ethos, and because we included studies internationally, that is also one of the limitations of our review, that there's not an awful lot of information provided necessarily within these studies about what the ethos and sort of like impetus on using evidence-based care is, and those are likely to vary greatly. So we have marked that as one of the limitations of the review. But that said, there are also commonalities across the barriers and facilitators that we found, even though those organisations are bound to have different backgrounds and levels of care, etc.
Thanks, Ari. A question for you, Holly, and that's from Ramesh Pereira Delcourt, who asked, did your papers include how to address the clinician barrier? Oh, sorry, no, I think this one is for you, Ari. Apologies. Back to you again, Ari, about how to address that. You identified the clinician level barriers of attitudes towards evidence-based practice. So the question was whether there were any papers that talked about how to address that, how to make attitudes more positive.
There's sort of very little around this. As I say, it was more seemed to be the papers that we're going through was like identifying those barriers of potential poor attitudes and things like that. So there wasn't anything that really stuck out as these are poor attitudes do this in order to improve them, which is what we're trying to work on in our sort of like key clinician points, really, because they also do like provide facilitators as well. But as I say, lack of joined up thinking around that as well. So off the top of my head, there wasn't a specific paper that addressed sort of like a specific strategy for that, although a lot of the facilitators that we found in terms of introducing EPBs, education around EPBs at sort of like clinical training level, rather than just when you're rocketed into clinical practice and expected to do them, things like that, as well as like a really strong leadership element that is devoted just to evidence-based practice and stuff like that.
Thanks very much. And now this one is for you, Holly. But however, there's also a question asking this more generally, so I will come to you, Abi and Ari, as well. And this is about whether any of the papers looked at whether co-design, co-production did serve to improve implementation by improving any of the other factors, usability, acceptability, etc. You highlighted that that's one of the things that you're looking at. So it'd be great to hear any impressions that you have now about the evidence relating to young people's participation in general and co-design, co-production specifically, and how that relates to implementation.
Yeah, I haven't come across any papers that have made that connection themselves, but that's certainly something that we're hypothesizing might something that could be related. So we've extracted data on co-design and co-production in our data extraction from the papers itself, but actually we've got loads of gaps. So in the survey, we also asked about co-design and in what way was their app co-designed. And our survey has kind of open answer questions too. So we've got a bit of qualitative data. So I'll need to look in and see if any of the authors that responded picked up on anything to do with co-design, but my sense is that they haven't. But yeah, it's certainly something we want to explore to see if those things are connected. And I think co-design, I think often these papers say that they co-design something, but it hasn't really been co-designed. It maybe be a one-off focus group or something, and you know, it's kind of tokenistic. So yeah, certainly something that we think is important and we're looking at.
Thank you. Abi, did you have any reflections on the role of co-design and how it related to the successful or otherwise implementation in your review?
Yeah. Just to echo really what Holly said, I mean, in my case, there wasn't any explicit mention of the link there. I mentioned that there were a few barriers and facilitators around student responsibility and involvement in the interventions, but yeah, as I say, explicit mention of that as a link and potential aid for implementation, yeah, was not really reported within the papers.
Thanks. And Ari?
Yeah, same really, just to echo what both of you have said. I mean, the papers that I was specifically looking at, a lot were aimed really at those clinicians and at those clinical settings. And there wasn't a lot about, or really anything that I can think of about reporting on co-design within those. So there was a big old gap there.
Thanks very much. I'm aware that there are some more questions in the chat, but also very keen to let you all have a brief comfort break at this stage. So we're just going to take a brief pause now, just for 5 minutes, and we'll start again promptly at 12 o'clock. But Abi, Ari and Holly, if you're happy to respond to other questions in the chat and or in the Q&A, that would be really wonderful. Thank you. But to everybody, thank you ever so much for joining us again today. And thanks again to our speakers from the session so far. Please don't go away. So please just mute and turn your video off so you're still in the session, because we've got some more fantastic talks when we come back after this brief break to hear more about the consultation work that's been conducted to help inform this call. So we'll see you all again in a couple of moments. Great. Welcome back, everyone. I hope you've enjoyed the session so far as much as I have. I'm really delighted now to introduce Georgia and Nimra to you, who've been working alongside Abi, who you've already met this morning, on establishing priorities for our Emerging Minds funding call. Nimra is a PhD student at the University of Bath, and she's researching and developing an intervention for parents of trauma-exposed children. And she's been involved as a research advisor for the Emerging Minds Big Question Research Challenge, and has helped with co-facilitating the workshops with young people and parents and advising on the priorities for the funding call. And Georgia is a mental health campaigner and works and volunteers in CAMS and in the third sector. And Georgia's been involved as an advisor to the Emerging Minds Big Question Research Challenge, helping to co-facilitate the workshops and inform the project as a whole, and has been a long-serving member of our Emerging Minds advisory group, I think pretty much since we started. So we're hugely grateful to them for their input generally and to this funding call particularly. And as well as reviewing the academic literature, as we've heard about this morning, we also wanted to hear from those with relevant lived experience and expertise to establish meaningful priorities for this area of research. So we've talked to those commissioning evidence-based services for children and young people, as well as those young people living with mental health difficulties and accessing services. We also spoke to parents and carers who were supporting family members in accessing support and managing their mental health. So Abi, Georgia and Nimra are going to talk us through the work that they've been doing, consulting with these different groups, and tell us a bit about what's come out of that so far. So I'll hand over to you, Abi. Thanks very much.
Thank you, Kathy. Great. So I'll just pull up my slides to share. Perfect. Yeah, so just a bit of an overview of what we're going to talk about over the next few minutes. So as Kathy mentioned, we thought it was really important to speak to commissioners, policymakers, parents and young people who are actually interacting with research on the ground. So what we're going to do today is just provide a bit of a background as to what we did, and we'll talk about the process, how we interacted with parents and young people and commissioners, and then we'll give an overview of some of the findings and key themes across each group and also across all the groups together. And then we'll finish by outlining the key priorities for this research challenge, which have come out of these consultation and priority setting activities. So I'll just give a bit of background. So the literature doesn't hold all the answers. As I found in my review later on, it really doesn't hold very many, especially in terms of community and voluntary sectors. So it's really crucial, I think, to speak to those people on the ground who are actually experiencing and interacting with research and trying to implement it to support children and young people. So we set out to speak to those people, and we plan to take forward their thoughts, experiences and contributions in this area to form our priorities for this funding call. So as I said, we spoke to three different groups, as it were, of people. So we spoke to commissioners and policymakers across clinical, community and voluntary organisations. And we did this by carrying out one-to-one interviews, and we also had an online survey, which was basically the same as the interview, but just an online version which people could complete in their own time. We spoke to young people through a virtual priority setting workshop on Zoom, and similarly parents and carers, we also held a workshop with them virtually too. So I'm going to begin by just giving a bit of an overview of the findings from speaking to commissioners. So as I said, we did some one-to-one interviews and we also had an online survey. So I interviewed 10 different commissioners and we had 11 people complete our online survey. Largely, these were commissioners from a clinical background, so clinical commissioning groups or clinical service providers, but we did also hear from some people who were leading multi-academy trusts, and we also heard from people working in mental health support teams, and also local authorities, training providers, charities. So these were the questions which we posed to commissioners both in our interview and in our survey. So we first started by exploring the idea of what evidence-based actually means. And then we went on to discuss What were some of the things which were perhaps stopping the implementation or also facilitating the implementation of evidence-based practice? And we also inquired as to whether there was something specific about the sector within which each commissioner worked, which might be helpful or unhelpful when implementing evidence-based practice. So some of the key findings that came up from these consultations, I'm sure don't come as a surprise, but one was around the limits to resources, funding and time. And this was something that came up across the board as a barrier to implementation. But as well as that, we also heard a lot of comments from commissioners, across clinical and community-based organisations for improved accessibility and communication of research and evidence. There were many comments from our conversations and a definite feeling of disconnect between the evidence base and commissioning on the ground. Not knowing really where to look, having sort of sometimes an overwhelming sense of information, from loads of different sources, NICE guidelines, different research networks, and just so much information that it feels inaccessible to those who are trying to use it and work on the ground. So that was definitely something that came up within our conversations. So yeah, as I mentioned, a feeling of disconnection between the evidence base and the practical reality of challenges on the ground. So we heard from many commissioners, especially those working within the voluntary and community sector, that oftentimes when faced with evidence, it required a lot of work and clever adaptations around trying to make it work for your service and your population. So I had lots of conversations around regional differences and also service differences, population differences, and that provided a real barrier in terms of implementation at scale, and it's definitely something to consider when thinking about implementing research in practice. So this sort of feeling of disconnect and this overwhelm of evidence did go on to lead for, to call for a need for a broader, more inclusive definition of evidence base, which was more accessible for those commissioners. So a lot of commissioners mentioned that the evidence base oftentimes feels removed from the actual reality of working on the ground. And if perhaps the definition of evidence base was broadened, then they would be more likely to be confident in implementing different forms of research within their children and young people that they're trying to support. So for example, a couple of commissioners mentioned some of the practice-based evidence that they were gathering on the ground and how that felt perhaps softer or more woolly than the evidence-based practice that they were being encouraged to carry out, and a frustration around that. Because of a need for sort of greater co-production of research with young people and parents and those who are actually experiencing mental ill health, and in sort of broadening the definition of evidence-based, including more practice-based evidence, consulting with children and young people, it felt like that was a much better solution to implementing research. I think it's also worth mentioning as well at this point, around a lot of commissioners called for co-production with commissioners themselves. So actually when implementing evidence and carrying out research, actually speaking to those people who are going to be commissioning it within their services, consulting with them and involving them in that process at every level. So not just young people and parents, but also commissioners too. So yeah, so those were some key findings that came up from commissioners. I'm going to hand over to Nimra now, who is going to talk you through our consultations with parents.
Lovely, thank you, Abby. Yeah, we then carried out a workshop with parents and carers of young people with lived experience of mental health difficulties. And we facilitated discussions surrounding the following 3 questions. Abby, if you could change the slide. Lovely. So the first one was, how important do you think research is in improving services? The second, where have you seen research being used effectively in your child's care? And The third, what do you think are some of the barriers and facilitators to putting research into practice? And some key themes emerged from these discussions. The first of which was a recognition of the lack of capacity and resources available to achieve change. So within this theme, parents discussed some barriers which may limit the implementation of research, and they recognise issues such as lack of capacity within services, funding issues, as well as time constraints. Other parents also perceived and they felt like there was a lack of desire for change within the workforce and an over-reliance on the medical model, which limited the individuality of care as well. And others felt that the workforce wanted to change but couldn't due to the barriers previously identified. And overall, they felt that this lack of capacity, resources and openness led to a lack of communication. Abi, if you could change, lovely. So the importance of communication and trust has emerged as a significant theme for parents and carers across the board. They were motivated to learn about research, but they felt that research wasn't accessible. So that was both in terms of the language used, as well as physically being able to access research. They felt that it was just hard to get a hold of it. And there was also discussion around a lack of communication across departments within services, and as well as a lack of communication from practitioners to parents themselves. And overall, this lack of communication manifested in feelings of fear and mistrust. Abi, lovely. So all of this lack of communication and feelings of fear led to an increased desire for parents to be heard, because they felt their voice wasn't recognised or valued as much as it should have been. So, but they provided a few solutions. So one of which included co-production, and that was both with parents, carers and young people. And they felt this was a really important aspect because it acknowledged and took on board the experiences of the individual and acknowledged that parents were the real experts in their child's care. And another key theme which emerged was the advocacy of bespoke and individualization of care. They felt that, like within the current model within services, there was a one-size-fits-all approach which didn't appreciate the child as a holistic being and wasn't tailored to the young person's regional or the service's needs. So therefore, all in all, co-production was seen as a key solution to the improvement and the implementation of research into practice. Thank you.
Great. Georgia, do you want to share some of our findings about young people?
Yep. So yeah, another workshop we led was with young people who were really fantastic at sharing their insight. Here's some of the demographics of the groups we were working with. So we asked them similar questions. Next slide, please. Yeah, how important do you think research is in improving services? Where have you seen research being used effectively in your care? And what do you think are some of the barriers and facilitators for putting research into practice? So similar findings came up with young people as with parents and commissioners, just with a slight difference in perspective. So some of the general themes are here. So the first one is recognition of the lack of capacity, resources, but also willingness to change. So they're aware of like limited resources due to funding and the abilities to implement research in services, therefore keeping things the same, which has been picked up across all the talks today. But they were very understanding of this, so understanding that CAM staff are incredibly overworked and again, issues with funding. Second theme was the clear need to improve communication and accessibility of research for young people, which is a real key theme in that research might not be accessible in terms of language and jargon used and lack of communication of research being used in their care if it is used in their care, and lack of communication across the different sectors. Also raising the issue of accessibility. Zoom has helped facilitate this in terms of young people being able to attend these workshops, but still limited to certain groups being able to come forward. So the big discussions around people that are coming to these workshops are motivated to, but so we're therefore missing out certain voices or certain demographics. And yes, so another theme was need for openness to innovation and global collaboration. So young people recognise that research is important, but we need to be constantly moving forward for effective care, needing to be open to new ways of collecting evidence and delivering care. So both looking at past research, but also making sure that we are still moving forward at the same time. Which leads into the really big point of the importance of co-production, youth voice and feeling heard, which was, I think, the biggest theme that came out of this workshop, was that co-production is really important and can help take the strain off of services, and using lived experience allows research to be more effective and applied to the real world. But again, awareness that only certain voices are being heard and have to be actively sought out, and we're very mindful of this limitation. Also recognising that there's different individual, regional and cultural differences. And again, as Nimra pointed out, things need to be more tailored to the individual, both within research and within healthcare as much as possible. And really emphasising that the more voices that we can hear from, but particularly the more diverse voices we can hear, the better young people can be represented and helped, both within research and in healthcare. But yeah, it was a really great workshop, and the young people were really, really insightful. So we're thankful for those that joined. So I'll pass back to Abi.
Thanks, Georgia, and thanks, Nimra. I think it's worth mentioning at this point that the richness of the discussions that we had with commissioners, parents and young people, and the openness in their sharing of experience was incredible, and we're extremely grateful for their involvement in this project. What I'm going to do now is just give a bit of an overview of some of the key themes which came out across all groups, which should go towards some key priorities for this funding call. So just an overview of some similarities across all of the groups. I'm sure you will have been able to see some key themes coming up already, but all groups felt that in order to be implemented, research needed to recognise, listen to, work with and be adaptable to needs on the ground. So this isn't to say that an intervention has to go through a dramatic change within different services, but the way in which it is applied needs to be sensitive to the needs of the service and the region within which it's trying to be implemented. All groups also recognise the importance of research to underpin practice. I think that's really crucial to note, is that every single person we spoke to really felt that research was key to shaping practice and the care that we provide, but did feel that the traditional definition of evidence-based needed to be broadened, as I mentioned, to include things like practice-based evidence, co-production, and less traditional methods of evidence gathering. All also recognised capacity as a barrier to implementing research in practice, but did feel that there were ways around this. So despite the obviously the barriers that all of our services are facing at the moment with demand and resourcing, suggestions, for example, around co-production were provided as a way of getting around that. So parents and young people especially were incredibly willing to volunteer their time to take that strain off of our clinicians and service providers and help to put research into practice. So that's also important to note. So what we did next is we basically looked across all groups and all of the themes that came up and came up with 4 sort of key areas which are important to keep in mind for this funding pool. So the first of these 4 C's, as we've called them, is communication. So how is research communicated to those who are working with children and young people on the ground? So we have a hugely diverse workforce. We have a hugely diverse population of people who are seeking support and who are interacting with research. So how are we communicating in an inclusive and accessible way with all of those people on the ground? Second theme which came up was obviously around capacity. So how can research be implemented in what is a very strained system of support, extremely overstretched and lots of demand? But also within this theme, we also explored the capacity for change. So the readiness and willingness of services to implement research and to know what works and put that into practice. Another theme which I won't go too much into because we've discussed it in great deal was co-production. So meaningful and effective involvement at every level with parents, young people, commissioners, and those people interacting with research in practice. So not just at the research stage, but also through to dissemination and also implementation, making sure that we really listen to the voices of young people, parents, carers, and commissioners too. And the final key theme was around change. So this was discussed in great detail around what needs to change in order for research to be implemented. So we had a lot of conversation around how much actually needs to change. So do we need, you know, an overhaul of resourcing and time and energy? Do we need to interrupt services and change everything in order to put research into practice? Or can we work with what's already out there, what already exists, and what's already available and known to services and staff? And also within this theme, thinking about the diversity of regions and also services and their different needs. So as I mentioned, not feeling like the very fabric of an intervention has to change, but thinking about how you can apply this and change the way in which you apply this to suit those with which you're interacting. So those were our overarching themes, and we took those themes and culminated those in 2 key priorities for this funding call. So we would like to fund research projects that address these 2 questions. So the first question is, how can we enable decision makers to better understand, use, and allocate resources for research and evidence in practice? The second question, which we'd like to fund research projects for, is how can research evidence be co-adapted to meet local and specific needs in practice? So we took all of our conversations with parents, carers, young people, and commissioners, and formed these 2 questions, which were priorities from these groups. So 2 key areas to think about when seeking funding for this work. So yeah, thank you all for listening. Again, thank you to all of the parents, carers, commissioners, and young people who were involved in this work. And also a huge thank you to Georgia and Nimra for their involvement on this project. Been huge helps in advising and helping put this together. So I will hand back to Kathy, who will tell you a bit more about the funding call.
Great, thank you very much. Yes, absolutely. Huge thanks, Georgia and Imran. Big thanks to you, to Abi. I'm going to go straight on to tell you a bit more about the funding call now. But if Abi, Georgia, Nimra, if you're happy to answer any of the questions in the chat, and any of our previous speakers also are welcome to wade in, and also, you know, I encourage the rest of you to join in on the discussion while I tell you a bit more about the upcoming funding call. So I'll just share my screen now. Can you see a slide, or can you just see a black screen?
It's black, yeah.
Ah, interesting.
Oh, there we go.
There we go. How's that? Yeah. Okay, brilliant. So just to tell you a bit about the upcoming funding call. So we are coming towards the end of the Emerging Minds network. So this final funding call has a fairly short time duration to it. So it's really very much a focus on funding work that's either going to have a very rapid impact, or where it is very much a starting point, and clearly a starting point for further research to follow. So the funded projects will need to be delivered within 6 months, and that would need to begin by April next year and be completed by October next year at the latest. And the total funding that we have available that in this funding call is £140,000, and we anticipate that that would be either fund 2 projects worth up to about £70,000 each, or 1 project for up to £140,000. So essentially, we'll be having to make a difficult decision about, are there, you know, is there one big project here that we feel will have a bigger impact than 2 smaller projects, or do we think we'll get more of a sort of bang for our buck with 2 smaller projects? And we're particularly focusing on how projects are going to use their findings to make a difference to the field of youth mental health. So we'll be looking for clear evidence and clear plans on how applicants anticipate bringing this about. And as always, with our Emerging Minds funding, we want to fund projects which are collaborations across disciplines and across sectors. And we strongly encourage collaborations with the voluntary and community sector and people and groups that include people who have relevant lived experience. And we'd also really like to support projects which offer opportunities for early career researchers. So please do think about that in the composition of your teams and where you can create opportunities to build capacity in this important research area. We'd really like to see that in the applications. However, consistent with, despite these things being our aims, there are some UKRI guidelines that we have to follow. So the project lead or one of the co-leads must be based at a UK higher education institution. So we really encourage cross-sector involvement in the research projects, but there has to be a lead, at least a co-lead, who is at a UK higher education institute. And also each individual can be a lead applicant on just one application in this funding round, although an individual or organisation can get involved in project teams of an unlimited number of proposed projects. They just can't lead more than one. So a couple of key dates to mention here. So we invite expressions of interest to this call. This is optional. You don't have to put in an expression of interest. So if you miss this deadline, you can still put in an application later on. However, we encourage people to put in expressions of interest because that's an opportunity for us to have a look and give some initial feedback just on how well we feel that the application fits the funding call and what we're looking for. Sometimes we have a situation where we get a couple of applications that are actually very similar and where the different teams may have different strengths. So there can be benefits of, we might suggest potentially speaking to another group. There might be options to link up, for example. So that's quite a light touch, but hopefully a helpful process. So I'd like to encourage you to do that. But as I said, that's optional. And we'd give you feedback on those expressions of interest by the 8th of November. And then the deadline for applications is the 16th, 9 AM on the 16th of December this year. If you've applied for Emerging Minds funding before, you'll have seen that the applications are a relatively light touch compared to some funding applications, but obviously really critical that you evidence how you meet the key criteria, which I'll go on to talk about in a moment. And then we'll be conducting remote interviews for shortlisted applicants in February 2022, and we'll be able to come back to people with decisions very quickly after that. So all of our Emerging Minds funding calls involve reviewers who bring a range of different experience. So it will generally include members of our Emerging Minds leadership group. We may call on other subject experts and also our Emerging Minds advisors, both young people, parents and carers, and also our partners from voluntary community sector organisations, policymaking organisations, also get involved in the review. So just to be really clear, and so you're aware that we have this broad group who bring a broad range of evidence and expertise, who'll be looking at the applications to really make sure that what we're doing, meets the need and fits the realities. So I'll go on to talk about what we're looking for specifically at the moment. And as I mentioned, we'll be conducting Zoom interviews. But these are the key priority areas that we'll be looking at when we're making decisions about the funding. So first of all, a really key thing is, to what extent is this project likely to make a significant contribution to the priorities that have been identified by stakeholders? So that was in the early stages of the Emerging Minds network. So please do go back to our website, have a look, at the consultation work that underpinned the development of the research challenges in the first place, but also, of course, the priorities identified by our stakeholders that have been identified and described by Abi, Georgia and Nimra just now. And it will be also important for us to see to what extent the outputs of the project will be useful for and shared with those that can best use them. So we'll want to see how the findings will get out there to people, beyond the research team, and to also, to see that there's a clear recognition of who the most important audience members are, who needs to know about this research and how will they get to know about it. And we'll also want to be able to see what the potential is for the research to be sustained and or developed. As I said, we're always really keen to encourage cross-sector partnerships. So we'll be looking at the extent to which the project includes non-higher education institute partners in substantive and meaningful ways, and particularly to what extent young people, family members and other stakeholders are meaningfully involved in each aspect of the project. We'll specifically review on the opportunities that are provided for early career researchers within the team. And we'll also be looking at the extent to which the project makes the most of opportunities for collaboration across disciplines to maximise potential impact. So really key that you have a think about how each of those areas can be meaningfully covered. And then, of course, it should go without saying that we're looking for evidence of excellent research and planning. So we, of course, need to see that there's a clear rationale for this particular study that's justified with reference to the existing research literature. We'll want to be able to see clearly that the proposed methods will achieve the aims. And we'll, of course, want to be able to feel confident that the proposed project can realistically be implemented in the proposed time frame. So please do keep an eye on those factors and make sure that they're well evidenced in the application. And we also want to see, of course, that the project team have the relevant abilities, commitment and support to implement the project, that the funds reflect value for money in relation to the planned work and the outcomes are achievable. And also that we want to see that the group are aware of any risks that may come with the project and have good plans in place to manage any potential risks that may be there. And we want to also see that there's an evidence of a commitment to reproducible research practices. So the finances part, here we have to adhere to UKRI guidelines, which means that we can only cover 80% of the full economic cost of the project. For that, so this will hopefully make sense to you, those of you in higher education institutions. For those of you who are not in higher education institutions, you'll need to have at least a co-lead who is in one of those organisations who should be able to take on this aspect of it. The UKRI guidelines stipulate that non-academic partners can receive up to 30% of the total applied for. So please keep that in mind when planning your application. And non-academic partners can claim for 100% of the costs that they incur. But we make our standard terms and conditions available on the website in advance of the funding being awarded. So please do have a look at that right from the start and discuss that with your contracts business development team right at the beginning, and just make sure that these are terms and conditions that they're going to be able to sign off when the time comes. But just as an example, for a university to receive a grant from us, they would have outlined project costs in their budget of 43,750, showing the full economic costs, and administrative costs, so including estates and indirect costs, should be really carefully considered and are capped at no more than 20% of the total application cost. So again, this is for people in higher education institutes. So that will be something it's really important to discuss with your research support teams, as that's something that they may query. What we very much hope is, because we see this as early stage pump priming research that can then really accelerate further research in this area, we really hope that this is these are terms that institutions will be happy to get on board with because of the potential it brings for future funding down the line. Okay, so we'll just take a moment here to have a bit of a pause and answer any questions that you have. So I'll just stop sharing my screen for a moment, and in order to have a look at the chat. But if you do have any questions about the call itself, please do pop them in the chat now, and I'll just have a look and see what we've got. Okay, so just having a look at questions specifically about the funding call. If you have any, do put them in the chat. There was a question about sharing the contacts of people who signed up for the information session, which I can imagine would be useful for you for developing collaborative proposals. So because of we can't share any information without people giving us consent to do so. So if you are happy for your contact details to be shared, please do drop us an email at the Emerging Minds website, so that we then have your consent to do that, and we'll do that wherever possible. I can't see in there any questions specifically about the funding call. So I will just pop my slides up one more time, which hopefully you can see there now. So just to give you a reminder then, that expressions of interests need to be in by 9 AM on the 29th of October. As I said, those are not compulsory. However, you know, we encourage you to submit those. And then the final deadline for applications is 9 AM on the 16th of December. But if you have any questions at all, please do drop us a line at the Emerging Minds website, and you'll also be able to find all of the information about the call on our website, and we'll be bringing together all of the slides and the recordings of today and putting that up there as soon as possible. So I see there's just a couple of things that have appeared in the chat, so let's So I see that there's also some questions about the parents, carers and children and young people that contributed to the consultation, and the commissioners as well, and whether any of them may be interested in further involvement for supporting your collaborative applications. Essentially, I think there was a lot of enthusiasm for the funding call. So if you are keen to link up with more young people, parents and carers or commissioners, then do drop us a line, because and then we can make introductions to any of those people who've participated in the consultation so far. I also saw that there's a question about the application form. Yes, there is an application form, and you'll be able to find that on the Emerging Minds website. So please do have a look there, and you'll be able to see all of the parts of all of the questions you'll be asked. And there's also a question whether there's a follow-on funding call for research designs that are more advanced. Unfortunately, the funding for the Emerging Minds Network comes to an end towards the end of next year. So this is our last funding call. However, and we very much hope that this will be a sort of opportunity for people to do the sort of earlier stage research, which will then enable them to apply for more substantive funding through the research councils, through their various schemes. But please do be aware of a call that has just come out from the MRC, the Medical Research Council, from their adolescent mental health and developing mind programme, where they've just put out a call for methodological research that's focused on young people's mental health. So do have a look at that, because there's far more substantial funding in there, and they are very keen to support research that is about improving methodologies. And I know that they're interested in things like co-production and co-design, as well as many other things. So it's quite a broad remit. So please do have a look at that as a sort of broader opportunity. And oh, thanks very much for popping that in the chat. So I've just seen another comment about whether we're allowed to choose the subject we're interested to make the application. Yes, absolutely. As long as the specific research question addresses the areas and the priority areas that we've identified for this call, then within that remit, you can, obviously you can set the question yourself. So I'm just quickly checking. Okay, so I think that probably answers all of the questions that we have about the call itself. So I just want to finish by thanking everybody for joining us today. A huge thank to all of the contributors. It's been really fantastic to hear about the reviews and the consultation work that have all been conducted recently and have all been hugely influential in developing this call. As I mentioned, the recordings of the talks will be available on the Emerging Minds website, so please do keep an eye on there. And also please do follow us on Twitter if you're not already, and also sign up to receive our newsletter, because you'll get more updates in those. So we regularly share information through Twitter, but the newsletter is also always jam-packed of news of things that we're doing here in Emerging Minds, but also trying to share great examples and other activities and things that are going on, funding opportunities and so on, from our partners. So if there are things you'd like us to share in the newsletter, please get in touch, but do sign up for it. It's always a really full and interesting read. So please do follow up, have a look at the website to find out more about the funding call. And we really look forward to hearing from lots of you with your expressions of interest in the near future. So huge thanks again for joining us, and please do get in touch if you need to. Thanks a lot.